Hi, everybody. This is Dr. Britt Talley Daniel, MD, and I'm a neurologist, headache doctor, member of the American Academy of Neurology and the American Society of Headache. This is the fourth podcast. I'll be talking today about sinus headache. So, in line with the other articles I've written about or talked about, I'm going to do this kind of like at the beginning, like a teaching situation where a patient is brought in from the front lobby to talk to the doctor, and there's a dialogue that goes on. So, I start with, the doctor's secretary spoke to him at the front office. Dr. Eccles sent over your next case. She's a copy of the scan with her. The doctor escorted the patient to his office, had her sit down. He said, I know your ENT doctor sent you over. Yes, Dr. Eccles said he couldn't find anything wrong with me at all, and he wanted me to see a neurologist. The patient answered somewhat crossly, I've been having these sinus headaches since my 20s. Well, tell me about them, the doctor replied. They're just plain sinus headaches, here across the bridge of my nose, behind my eyes, or in my forehead, the patient replied, indicating the involved anatomical areas with her hand. Do you have any other kind of headache, the doctor asked. No, the patient replied testily. This is the only kind of headache I get. What treatment do you use for your sinus headaches? The doctor asked. Well, that's why Dr. Eccles sent me here, the patient said cautiously. I wanted him to give me something for pain like Vicodin, and he did that for a while, but now he doesn't want to do it anymore. I usually take Tylenol Sinus for my headaches, but lately it just doesn't work anymore. How frequent are your sinus headaches? The doctor asked. Oh, I have 1 or 2 a week usually, and it's worse during my allergy season during the spring, the patient replied. How long do the headaches last? The doctor asked. Not too long, just a couple of hours, the patient said. How severe are they? The doctor wondered. Again, not too bad. On a numerical scale, about 7 or 8, from 1 to 10, the patient replied. Do you get nauseated with them, or do you want to vomit? The doctor asked. Sometimes nausea, but I never vomit, the patient said. Are you sensitive to light or noise with the sinus headache? The doctor asked. Yes, well, sometimes light. I have to wear my dark glasses or get in from the sun. Sometimes driving may aggravate me, the patient replied. Does the sinus headache ever put you to bed or change your life so that you can't tolerate activity or just being up? The doctor asked. He watched a grim smile spread over the patient's face. Well, it never used to, but now she stopped talking and appeared to be upset. And so you take 2 Tylenol Sinus tablets for treatment, is that right? The doctor asked. Yes, the patient said. It used to work, but now I just go to bed and sleep for a few hours, and then when I get up, it's all better. I see, the doctor replied. The occurrence of a sinus headache, does it come after you've had a cold or upper respiratory infection? I mean, within days to a week, the doctor asked. I don't recall I've had to be sick with an infection before a sinus headache starts, the patient said, so I would answer no. When you have a sinus headache, do you have a nasal discharge? The doctor asked. No, well, yes, sometimes, I guess. I mean, usually I just feel real stopped up and congested in my nose, but sometimes I have a slight discharge, especially if my allergies are going, the patient said. And the discharge, is it green, yellow, or clear? The doctor asked. The patient gave him a sharp glance and fiddled with her purse. To answer, she turned her head to the side and looked up at the top of the room. Clear, I think, if there's a discharge, she finally answered. What did Dr. Eccles say about your CAT scan of your sinuses? The doctor added. He said the radiologist read it as showing mucosal thickening in both maxillary sinuses. Did he add any treatment for the headaches? The doctor asked. He said, just keep taking my Tylenol Sinus and try some Claritin, the patient said. Okay, I'm ending that dialogue there, and I'm going to start with talking about sinus headache, which is really a lay term. Sinus headache is one of America's most misunderstood diagnostic problems. I say America because the mistake of calling frontal headaches that have features of migraine without aura sinus headache is purely an American phenomenon and doesn't exist in England, Europe, or the rest of the world. The miseducation in the States is due to a vast marketing blitz on television, radio, the internet, magazines, and newspapers by the makers of pseudoephedrine, the main active ingredient in Tylenol sinus tablets, and any of the 100 or so over-the-counter sinus medications used to treat this syndrome. All right, my feeling is to understand headache attributed to rhinosinusitis, you have to understand 4 different areas. A, the trigeminal vascular theory of migraine. B, acute bacterial rhinosinusitis. C, allergic rhinitis. And D, the ability of Sudafed to treat mild migraine headache. So I'm going to talk about those sequentially, starting with A, trigeminal vascular theory of migraine. All pain in the face, eyes, teeth, and sinuses goes through the trigeminal nerve. The brain itself is not sensitive to pain. With an attack of migraine, the trigeminal nerve is activated and pain-sensitive chemicals, which are normally stored in the trigeminal ganglion or in the ganglion of cerebral arteries, are released. An important anatomical fact to remember is, then, that the branches of the trigeminal nerve and various arteries are located in the forehead, behind the eyes, in the nasal turbinates, and in the cheeks. One does not have to have a bacterial infection to have pain in these areas. Normal migraine-sensitive structures are located there and can carry pain to the brain from these locations. Also, irritation of the trigeminal ganglia at the base of the brain sends what is called referred pain into the face through its branches. An example of referred pain would be like you hit your elbow on the desk, you mildly traumatize the ulnar nerve at the elbow, and you experience pain and tingling down the forearm, which goes to the hand and into the 4th and 5th fingers. Well, the pain and tingling is in the hand and fingers, but the trauma was to the elbow. Since the ulnar nerve supplies the 4th and 5th fingers, the trauma at the elbow is felt in the hand and fingers and referred to as referred pain. Now, Hargrove has headache research has released a theory in which he has 4 cycles composed of migraine headache. They are trigeminal activation, number 1, 2, neuropeptide release, number 3, meningeal vasodilatation, and then 4, central pain transmission. So the trigeminal nerves are activated, and after about 20 to 40 minutes, there are 3 different neurochemicals that come out. These are called neurokinin A, substance P, and CGRP. And these chemicals cause vasodilatation and neurogenic inflammation of the brain, the nerves, and the arteries. After about 2 hours in this migraine sequence, the arteries dilate, and you have meningeal vasodilatation, and about 3 to 4 hours into the headache. So if it started at 8 o'clock, we'll say about 11 to 12 o'clock, we go to stage 4, which is the central pain transmission, where the thalamus is turned on, which is the pain center of the brain. And the headache gets really bad at that time. The final reaction after this is central sensitization, where the central nervous system, the thalamus, this deep central nucleus, is turned on and pain is felt there. Central sensitization is a theory advanced by a migraine researcher named Rami Burstein, with articles he's written previously. When the thalamus is activated, then the headache and suffering lasts longer, and the usual medications treat migraine, which are the triptans, don't work as well. All right. Next, I want to talk about B, which is acute bacterial rhinosinusitis. This is an infection of the nasal sinuses, which are usually the frontal sinus in the forehead, located above and behind the eyes, and or the maxillary sinus is located behind the cheeks. The sinuses are bony caverns in the skull, lined with mucous cells which connect with the nasal passages. The infection may occur spontaneously, but it also commonly follows a viral upper respiratory infection, such as a common cold would produce, or sometimes after symptomatic allergic rhinitis. Somewhere between 1 to 5% of colds may be followed by bacterial sinusitis. The sinuses then are invaded by bacteria, and the body's natural inflammatory response produces pus and copious green and yellow mucus, which come out of the front of the nose either spontaneously or after blowing. This green or yellow mucus is called purulent and comes from the word pus, which is the product of infection. And pus is made up of millions of human white blood cells that have died trying to combat infection. The patient may also have symptoms of anosmia or hyposmia, which means trouble breathing or can't breathe at all, frontal headache, fever, face or upper molar teeth tenderness, and malaise. The physical exam for a doctor may show fever, nasal crust around the nose of the dried pus and mucus, endoscopic finding of pus around the nasal turbinates in the nose, when the doctor looks with a special instrument inside the nose, and nasal obstruction. And the best way to see this by x-ray is to do a CAT scan of the sinuses, but also frontal sinus x-rays or MRI scans may be helpful. Well, if I see a patient I think has this, I usually order just a CAT scan without contrast of the sinuses. Although many patients recover without antibiotic therapy, the use of antibiotics should be considered in patients with prolonged or severe symptoms. Next, I'll talk about allergic rhinitis. Lay terms for this condition are sinus allergies or hay fever. The proper medical term is allergic rhinitis. Allergic means one has a hypersensitive reaction to some foreign protein that causes clinical symptoms, such as redness, a rash, sneezing, or a runny nose. Rhinitis means inflammation of the mucous membrane lining the nose, which is usually associated with a nasal discharge, in this condition, which is clear. Allergic rhinitis is a genetic condition which comes through families that may be brought out by exposure to an offending agent. My mother had allergic rhinitis, and I've got it, and 3 of my kids have it. For instance, somebody who lives in the Dallas, Texas area where I live, cedar comes out in November through February, and the cedar pollen is released in the trees. And persons may have allergic symptoms from that. When I was growing up in central Texas, we had 7 cedar trees by the side of our house. So I always told my mother that that was the enemy. If that same person lived in Arizona where there are no cedar trees, they're not exposed, they don't get allergic rhinitis. So after I finished my neurology residency at the Mayo Clinic in 1974, I volunteered for the Navy during Vietnam and was stationed in San Diego, California. I had no allergic reaction there at all. So an allergic reaction is an antigen-antibody reaction where the antigen is a foreign protein like the cedar pollen, and the antibody is a complex protein made by the immune system. Mast cells, which are part of the immune protective system of the body, are activated during an allergic reaction. Histamine is released, gamma E is made, and the patient experiences allergic symptoms of sneezing, tearing from the eyes, itchy eyes, and production of clear mucus from the nose. This clear mucus with an allergic reaction is different from the purulent, usually yellow or green mucus of an acute bacterial sinusitis. Testing by an allergist for allergic conditions concludes what's called the RAST test, that's capital R-A-S-T test, where the patient's arms or back are inoculated by a small needle with the different antigens, then judging the amount of surrounding redness and edema that may occur in a person allergic to that specific antigen. For instance, someone allergic to mountain cedar like me, when I got this test when I was 10 years old, I got a large, itchy, inflamed area following inoculation with cedar pollen. The doctor could also measure a serum gamma E level, which may be elevated, and is like a blood test for an allergic reaction. A confusing part of the migraine story is the reaction some people with migraine had to food or drink. Many migraine patients consider the headache they get from chocolate, the tyramine in red wine, or MSG or monosodium glutamate in Chinese food to be allergic, when they're really not. This is really caused by the International Classification of Headache. It's called headache induced by food components and additives. This type of headache should be bilateral, which means both sides of the head, nose, frontotemporal location, pulsating and aggravated by physical activity. The International Classification of Headache says that phenylphthalein phenethylamine, tyramine, and aspartame have been incriminated, but their headache-inducing potential is not sufficiently validated. There's also a MSG, or monosodium glutamate-induced headache, which usually comes with symptoms of MSG ingestion called the Chinese restaurant syndrome. And that consists of symptoms such as pressure in the chest, face, or neck, and burning sensations in the chest, neck, or shoulders, flushing of the face, dizziness, and abdominal discomfort. The headache from MSG is typically dull or burning, but may be pulsating in migraine patients. Many different chemicals trigger the trigeminal vascular system and aggravate migraine. This happens commonly in migraine individuals, and it's why MSG and nitrates and hot dogs may aggravate migraine. So there's a relationship between the ingestion of these chemicals and headache, but the headache comes along because of activation of the trigeminal vascular pathway leading to migraine by the offending chemical like MSG, and not from any allergic reaction, which is an antigen-antibody immune system gamma E liberation situation. The words allergy or allergic are not even listed in the index, the International Classification of Headache, so that in general there is no allergy headache. And if a patient has had allergic rhinitis with a runny nose, sneezing, and feels bad because of allergic rhinitis, he might have more migraine headaches because he's stressed out and sick and has irritation with his nose and sinuses through the trigeminal nerve. And treatment of allergic rhinitis may consist of avoiding the offending agent. The patient may choose to move to the desert, which doesn't have many pollen-producing plants or trees, or in my situation, live in San Diego, which would be wonderful because it's so beautiful. More ordinary treatment patient will take histamines, antihistamines like Zyrtec or Claritin, Loratadine, Allegra, and things like that. Or you can use Flonase in the nose or Nasocart, which help diminish allergic symptoms. Also, the patient may use pseudoephedrine or Sudafed as a decongestant. So Sudafed is really not an anti-allergy treatment. It really just constricts the arteries in your nose, and it's a decongestant. The fact that Sudafed has weak anti-migraine activity leads to myth about sinus headaches, which will respond to cytokines, and like all ads on TV have said, like they've said for years. All right, next I want to talk about the ability of Sudafed to treat mild migraine headache. Sudafed comes from pseudo, P-S-E-U-D-O, meaning false or untrue, as in a pseudo-intellectual, a name for someone who's really not very smart but thinks they are. The Fed part, P-H-E-D part of the word, is taken from the plant ephedra, E-P-H-E-D-R-A, a naturally occurring alkaloid. Ephedra, also called mahuang, M-A-H-U-A-N-G, is a naturally occurring substance derived from plants. Its principal active ingredient is ephedrine, which, when chemically synthesized, is regulated as a drug. In recent years, ephedra products have been extensively promoted to aid weight loss, enhance sports performance, and increase energy. They're in energy drinks, and we're all aware of that. Sudafed is a common drug in over-the-counter medications, and it's usually packaged with a non-narcotic analgesic like aspirin or Tylenol, which is acetaminophen. If you look closely at the fine print on the bottle, it'll say pseudoephedrine HCl. A typical example here would be Tylenol Sinus, which is Sudafed and Tylenol. Sudafed causes vasoconstriction of the small blood vessels in the nose, shrinking the extremely vascular nasal mucosa, opening the nasal passages, and acting as a decongestant. The advantage of the drug is that it produces a gradual but sustained decongestion effect, causing little rebound nasal congestion. So it's better for the nose to get decongestant orally through a pill than by directly putting something in the nose, such as Afrin nasal spray, which after several days will cause decongestant rebound symptoms, which is horrible. It's a stopped up nose that never goes away. You keep using Afrin and it just stays there until you get off of it. However, if you take Sudafed internally as a pill, it can cause medication overuse headache. Sudafed has rather common and unwanted side effects These are also usually listed on the bottle in small print, which are namely anxiety, irritability, an elevation of mood, mental alertness, increased systemic blood pressure, insomnia, and decreased appetite. With continued use, especially at high doses, tolerance to medication develops, and the user increases the dosage. Toxic signs and symptoms may occur. On my migraine blog, which is www.drmigraine.com, I have an article written about an energy drink with Sudafed in it that caused somebody to die from a stroke. Okay, Sudafed is often appended or added to antihistamine medication. It's the D or decongestant implied in Claritin D. It's Sudafed. Zyrtec is antihistamine D, Sudafed, or Allegra D, which is a decongestant, and Sudafed. The antihistamine works on the altered immune function, producing the allergy symptoms, and the decongestant, Sudafed, causes nasal arterial constriction, drying up the nose. This sneaks up on some people who don't realize what their doctors ordered. They find out they can sleep fine on plain Claritin, but they can't when they get on Claritin D because it wires them up. Another problem exists for generalized anxiety disorder or panic attack patients who may become more agitated on Sudafed, which acts a lot of ways kind of like caffeine. Patients with tremor, either Parkinson's disease or essential tremor, may find their shaking is worse if they take Sudafed. And Sudafed has a stormy side also. It's the subject of a recent FDA letter to Pfizer Inc. regarding promotional statements on a website. And that was at www.zytec.com. The FDA stated, quote, "These materials emit information concerning the risks of Zyrtec D and therefore misbrand the drug within the meaning of the Federal Drug and Cosmetic Act and the FDA implementing regulations. The omission of this risk information is a public health concern because Zyrtec D is contraindicated for several patient populations, and the ingestion of pseudoephedrine may cause serious adverse health consequences." Now, another problem has been the well-known practice of drug dealers buying large doses of Sudafed at the local drugstore and then changing it in their home lab, what's called a meth lab, to methamphetamine, which is a structurally similar chemical, and this has produced meth, or cheese problem, well known in America. In December 30th, 2003, the FDA issued a consumer alert on the safety of dietary supplements. And I quote that. FDA intends to publish a rule in the coming weeks that finds that dietary supplements containing ephedrine alkaloids present an unreasonable risk of illness or injury under conditions of use recommended or suggested in the labeling of the product. The alert advised consumers to immediately stop buying and using ephedrine products. Shortly after this news about ephedrine products hit them with a bang, and there are headlines all over America about ephedrine and all the problems that came from that. After that, the FDA banned the stimulant at any dose, stating the risk outweighed the benefits. However, a year later, a Utah judge ruled against this restriction, stating that low doses of 10 milligrams per day are not harmful. Currently, the FDA refuses to do testing of low-dose effects of ephedrine on the human body. A Department of Justice attorney for the FDA stated it would have been irresponsible to commission a clinical study to prove harm after the FDA began receiving reports of adverse effects. I can tell you, I remember when I got my medical license in 1970 in Texas, that Sudafed was dispensed as a doctor-written prescription-only drug then, 1970. By 1971, it went over the counter in Texas. A person could buy it without a doctor's prescription. So after this meth problem that's come, the addiction and mortality is produced has resulted in tighter controls for Sudafed across the country. I know in Dallas, Texas, where I live, Sudafed is now behind the counter with the pharmacist and no longer on the shelf. You have to show them your driver's license to get it. But in the state of Oklahoma, it's been banned completely, whereas in Utah, it's gone to doctor prescription only. All right. So does pseudoephedrine really work for sinus headache? Does it work for mild migraine headache? So it's a mildly effective drug for acute migraine. Today there are over 200 pseudoephedrine drugs in the use in the United States. And the sinus headache myth is driven by big pharma to sell pseudoephedrine drugs. It's also spelled Sudafed, S-U-D-A-F-E-D. It's been banned for importation in the United States by the FDA. The Wall Street Journal had an article about a man who made a meth lab in the men's room in LaGuardia Airport in New York several years ago. And I know in Dallas about 12 years ago, there was an article in the Dallas Morning News about a man who went to Eckerd's drugstore, which is now called CVS, and bought $5,000 worth of pseudoephedrine. And by the time he got back to his car, the cops were there and picked him up and took him home, where they found a meth lab. And he was planning to make Sudafed into methamphetamine to sell to school children in Garland, Texas, which is a suburb of Dallas. So what's the problem with methamphetamine? Methamphetamine addiction is a big problem in America, and methamphetamine comes from pseudoephedrine. So I've made a statement about that, which is hard and somewhat difficult, but I've said that the mafia has got behind the Sudafed industry to sell this drug, causing them many kind of alarm problem that's gone on all across America. Also, the Wall Street Journal said last year that Sudafed drugs, which result in methamphetamine, cause more drug deaths in America than opiate narcotics, which are such a big issue now. And usually they're the number ones. Opiates are the number one drugs that cause death. All right. I want to view the literature, the history of articles written about headache and then also about Sudafed. Dr. Lipton, a famous headache researcher, wrote in 1998 in Headache the title was Medical Consultation for Migraine Results from the American Migraine Study. And he pointed out that a significant portion of migraine sufferers never consult doctors for their headaches. Of those who do consult, 40% of migraine patients do not report a physician diagnosis of migraine. So if they actually see somebody, which is a minority of people, 40% of them don't get a diagnosis. Lipton also wrote another article called Undiagnosed Migraine Headaches, a comparison of symptom-based and reported physician diagnosis in the Archives of Internal Medicine in 1992. This was a mail-in questionnaire survey sent to 1,500 households from a panel representative of the United States population. He found that this survey of U.S. households indicated that a large percentage of severe migraine headaches are not diagnosed by a physician. Nearly 60% of females and more than 70% of males with migraine did not report having been diagnosed. More than 80% of those subjects with undiagnosed migraine experienced disability with their headaches. Many people with undiagnosed migraine, especially those with frequent or disabling headaches, would benefit from medical care. So, here are two articles, Dr. Lipton saying people don't see a doctor for a headache, and the other one is when they see him, they don't get a diagnosis of migraine. So, if large numbers of patients with migraine are not diagnosed as having migraine by a doctor, what diagnosis is being made? Well, a lot of patients make a self-diagnosis of sinus headache by watching television or going to the pharmacy and reading Sudafed advertisements on the shelf. These people know there's something, causing their headaches. They just don't know what it is, really. All right, there's another study done by Eros et al. In 2007 entitled The Sinus Allergy Migraine Study, published in Headache, where they recruited 100 patients believed they suffered a self-diagnosis sinus headache. This was done in the Mayo Clinic in Phoenix. And 55% of these patients were diagnosed as migraine without aura, 11% with chronic migraine, and medication of headache, 23% is probable migraine, cluster headache 1%. So the point was, persons who thought they made a self-diagnosis of sinus headache, most of them really had migraine. So out of 100 patients with self-diagnosis sinus headache, only 3 had headache due to rhinosinusitis. The rest chiefly had migraine or migraine and medication of headache. All right. Another confusing area is the common clinical situation of abnormal findings on sinus X-ray. Studies of asymptomatic patients, these are people who don't have any symptoms, and they get a sinus X-ray, have found mucosal thickening, like the patient had in this discussion, polyps, or opacification in one or more of the sinus cavities in 42% of patients. So pathological findings are seen in patients who get a sinus X-ray, people without symptoms. What you're supposed to see to make a diagnosis of acute rhinosinusitis is pus in a level like a shot glass full of water, a layer of pus in one of the sinuses. So this is ended by discussion of the sinus headache. It's a misnomer, sort of a myth deal. I hope this is helpful to education people about this. My regards and best wishes to everyone who's had migraines or sinus headache. God bless you. Go see your doctors and try to sort this out. I'll see you again on another talk. Bye-bye.